Just a minute. Okay, so good afternoon, everybody. Yes, today we are back again to our previous topic of autism, and the speaker for today is Dr. S.Poonguzhali. She has done extensive work on autism spectrum disorder, and she's going to speak on early diagnosis of autism spectrum disorder with Indian autism grading tool and its DD. Okay. So to tell you all a bit about her introduction, uh, she comes from the Vellore district of Tamil Nadu. She has completed her BHMS at Govt Homeopathic Medical College, Thirumangalam, Madurai district of Tamil Nadu at 2003. She has done her M.Sc psychology, PG diploma in yoga, PG diploma in acupuncture at Annamalai University. She has 25 years of experience as a research assistant for the DST sponsored project on design and development of childhood autism grading tool using soft computing techniques for 3 years from 2018 to 2021. On working with the project, she had exclusive exposure and experience with autism spectrum disorders. She has designed the questionnaire for the novel tool IAGT for the early diagnosis of autism spectrum disorder cases. The scale development data collection by exclusive interview with autistic children, parents, and special teachers is something that has, really helped her to make that grading or the tool. The tool validation and testing has been given varied research experiences. She has even published research articles in various national and international journals. So, over to you, Dr. Poonguzhali. We are eager to listen to you. Please begin.
Hello. Thank you, Dr. Alka, for the introduction. Good evening, dear doctors. Uh, Today, just I share my little experience with you. Okay. Um, if my voice is not that much audible, kindly ask in between. Okay. I mean, audible. Okay.
Yes, ma'am. Yes, you're very much
Okay.
audible.
Okay. Okay. Thank you. So, second slide, Rachana. Okay. First, just give the. I like to give the very brief introduction about the autism spectrum disorder. There is a many dilemma about the diagnostic criteria among the practitioners nowadays. So I think of sharing the diagnostic criteria. What are the features must be present in ASD to diagnose as it is ASD. Okay. So first, let me know the what is the autism spectrum disorder. It is a broad spectrum of deficits. They have them. There is a definite range of a condition. They have the condition should be yearly in the onset, and there is a delay and deviance in the development of the social communication, and there is a unusual response to the environment. These two things must be present to diagnose a child as a ASD child. Okay, there must be a social communication deficit, and there should be a unusual response to the environment. What is the unusual response to the environment? They include repetitive behaviors, and there is a difficulties with the change in the usuals. They like to keep the routine as it is. Like we think of it as an OCD like that. No, that is they doesn't like to change. They trying to have the same thing as it is. So that they have the unusual sensitivity to the environment also. So they must have the same things they have to do the same. That is the problem. The same things they are, do is the autism spectrum disorder. So there is some also social communicating. They doesn't understand the emotion, the emotional intelligence of the child is not yet grown. So that is the problem with the autistic children. So, so if you want to diagnose a child as an ASD, you have to label the child as ASD. There should be a persistent impairment, social reciprocal communication and interactions, and these symptoms can be noted since the early childhood. It can be noted even still since the 3 months of age. You can the mother can notice it. Okay, there is a they limit, there is a limitation everyday actions. They doesn't uh, uh, know how to communicate with others like that. There is a problem. So, according to the ICD 11, ICD 11 defined that there is a persistent deficit in the ability to initiate and sustain the reciprocal social interaction and communications, and the range of restricted, repetitive, and inflexible pattern of the behaviors and interest. So ICD 11 and DSM 5 are the diagnostic standards everywhere it is followed. Okay. Third slide, Rakshana. Um, so first know the early diagnostic features. What is the development within the with the infancy period? What are all the symptoms we can note? Okay, the even what is the what mother can note and complain. Okay. Even the sensitive mother can note the amount and time her child doesn't smile and looking at while she interacting. Okay. It is defined, she defined the child is too good. It doesn't demand me to pick it up and interrupting my daily works like that. So they are remain quiet, and even they refuse to hug and kisses too. They just doesn't like to pick up. Excuse me. Mobile, so there is a problem with me. So, okay, and now coming to the early clinical features of ASD, the onset is definitely at the early developmental period. Even it can be identified by the keen mother as her child, she doesn't smiles and looking at while she interacting, and defined as a too good child. She defined her child as a too good. It demands less. Less and less interacting in her daily chores, remain quiet and doesn't need to pick ups. Even she refused to hug and kisses. The child lies down quiet and stares at something or somewhere in the on the spinning fan, or if she keeps the colorful objects around, she looks and looks and enjoying it, the colorful things like that. So that and they doesn't look into the eyes of others. They doesn't love the human faces. They doesn't interested in the human faces, and they're just looking at the inanimate things like that. There is a problem in a child. They doesn't even respond to the name. Every name or some pet things we use for a child, they doesn't respond. They are in the own world of thoughts. Okay, they even you repeatedly calling her loudly, they doesn't respond. Okay, they be like deaf. Even the even hearing test as normal, the child is remains as deaf, doesn't respond to the um, comments or name calling like that. Okay. So on other hand, the child have very sensitive to the loud noises. They have very sensitive to loud noise like crackers or traffic sounds. If household sound like mixer grinder sounds or anything, they're very scared and closes her hands with hands or fingers to keep it tight closed and screams. Okay, so they also sensitive to the bright lights. They doesn't like to. They closes the tightly closes eyes during seeing the bright lights. Even they doesn't like the darkness also. They always like to. Some of the children, there is a difference with the some child sensitive to bright light, some sensitive to the darkness. So there is a difference. Um, uh, but also they love the colorful and glittering colors. The serial bulbs kind of if there is a function there is a colorful glittering lights they love and they enjoy that. Okay. So another sensitivity is that there is a extreme sensitive to the smells. They love to smell things, or they even averse to the smells. The love smells like very perfumes, some flowers. They even soaps. They keep it in the. They pick the soaps and smells repeatedly, or shampoos. They scents like that. Even they love. If a snacks is given, they just pick it up and smell it instead of tasting it. They are that much as smell sensitive is there. Okay. So even some food kind of things like they some smells of the food they nauseate. They totally averse to some kind of foods by the smell itself. Regarding food and everything, there is also food also there is a definite aversion or a definite desire is there. They usually loves the dry kind of foods. They doesn't love the sticky things. They doesn't love to touch the sticky substance like that. And they even nauseate to swallow the some florid kinds of things or curd rice like that. They just love to even love to eat the simply raw rice or simple raw chapati like that. Okay. Then coming to the sensitivity on the touch, they usually sensitive to whether hard or soft kind of things. Okay. Okay, I am audible. Okay. Hello.
Yes, ma'am, you're audible.
Yes, ma'am.
Okay, okay, okay. So is it clear? Is it I am clearly telling or the voice is
There
not
is some,
understandable?
the voice is muffling in the middle, but moreover, it's
Okay,
clear.
okay, 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 okay. So, okay, regarding the then coming to the touch sensitivity, they like to touch the soft kind of things usually, and sometimes even some child have the desire to hard. This is a vice versa. One child can have this, or one child can have that. Okay, like that. So usually they love to sleep with the teddy kind of toys. They sleeping with them. They always need to keep it. Some the ferret toys in hand always they have. If it is taken, there is a temper tantrums. Okay, one of the child, she loves her mother, used sari with mother's smells and smell on it. That yeah, if mother kept for washing, they used to keep it with her and to sleep. Otherwise, she doesn't sleep like that. Particular sensitivity to the touch and the smell kind of things. So, in coming to the play skills, they doesn't have the usual play skills like a normal child. They used to play in a unusual ways. They used to arrange them in order. This is the first kind of thing noted by the parents. They usually arrange in order. If the cards are there, they arrange in small to large, like or in color related colors. They are arranged in sorts in kind manner. They everything in the same order, like that they do it. They usually even they smell it and chew it uh, they usually doesn't allow to play in a usual ways. They usually bring the wheels of the car tie and keep it in front of the eyes, looking at the corners of eyes, and spin the wheels, looking the spinning wheels close to her eyes, like that they are doing. So there is no mimicking of the driving like a zoom like that of regular kind of players there. So there is a total absence of imitative and imaginary capacity. So doesn't follow the others. What they are doing, the doesn't follow the copy or follow the what other children play. Okay, or even they doesn't know how to do it. So they tend to be alone and play on their own ways. So regarding the language skills, early the child doesn't have the language development. That is a primary concern of the parent. They usually have the no normal the skills are there, so they use the mother's hand as a tool. This is the market feature of the autistic child. They pull the mother's hand. They bring to reach the things. So bring her mother to get the things. That is a artistic picture. Okay. Even if a child is verbal, there is no coordination of verbal and the non-verbal language. The body language and verbal expression is not equal with it. Yes, it is. So the child doesn't have the babbling or anything. So doesn't try to imitate the sound. Usually around 3 months, 6 months like that, child usually try to copy the sounds of the human. That is a normal child. If the child does, if the child is autistic, she doesn't do it. There is no babbling or imitation of the prosody of the language. What is they try to speak in our try to imitate like what adults speaking. That is not seen in the autistic children. Okay, next slide. Fourth slide. Oh. So then coming to the diagnostic feature of the ASD. Uh, what are the diagnostic feature given in the DSM-5? Okay. The DSM-5 what is classified as persistent deficit in social communication and interactions, restrictive repetitive pattern of behaviors and interest and activities. And above symptoms must be present in the early developmental period. These symptoms must be present in the early developmental period. Otherwise, it is not ASD. So these must cause the clinically significant impairment in the social, occupational, and areas of other areas of functioning. And these disturbances are not better explained by the intellectual deficiency or global developmental delay. So global developmental delay is the early diagnostic thing to the within 5 years of child. If there we cannot go for a regular testing, standard testing procedure for intellectual IQ testing. So global developmental delay is given to the less than 5 years children, and intellectual disability has given above the 5 years old children. So if to say them ASD, there should social communication deficits and repetitive restrictive features will be there, and these should be present in the early developmental uh, period, and these should not better explained by the intellectual whether it is not diagnosed as a intellectual deficit disability or global developmental delay. Otherwise, it is called as the autism spectrum disorder. So DSM-5 classifies the ASD as mild, moderate, and severe according to the severity of the symptoms and the requirement of the support. How much severe the symptoms or how much support that the child needs is the diagnostic criteria, and it has diagnosed as the mild, moderate, and severe ASD according to it. Okay. Next slide, please. Fifth one. Okay. Okay. Simply, there is a lack of social emotional expression. They doesn't know how to express the emotion. That is the primary problem with the autistic child. How to react in a particular social situation, and doesn't know how to talk and reciprocate it. If someone is talking, they doesn't know how to reply to them. So just blindly they indifferently talking. Okay, that is the feature of the ASD. They doesn't know how to express and express it. It is the problem. So they doesn't have much friends. So if doesn't know the emotion of others, they doesn't have much friends, and they doesn't know how to make love, or there is no emotion love relationship or romantic relationship in the adult and adolescent life also. So they remain aloof and avoid the all kind of social engagement and prefer solitary activities like that. So that and facial expression of the child or even adult, everyone, there is a flat expression and a monotonous voice. That is a social skill deficiency. Okay. So next slide, sixth one. So coming to the okay, fifth one, I think. Sixth one. Yeah, sixth this one. So coming to the language deficit, unlike language disorder, there is a peculiar echolalia is there. Okay. So they there's usually they doesn't understand the emotional thing, so they repeat the same words again and again, and they have used the jargon. They had their own made up of words and repeating it as it is. There is a monotonic intonations, and there is a lack of pragmatic. They doesn't understand the exact meaning of the word spoken word. If someone is joking or doing some sarcastic comments, they doesn't understand, and they take as it is and fight with them. So that is the problem. If so, there is if non-verbal, there is a lack of facial expression. Language facial expression is the language. No, if a non-verbal is there, so they have the no appropriate facial expression or body language and gestures. And verbal, there is a in coordination with the verbal and non-verbal things. So then next slide, seventh one. Seventh one. The restrictive repetitive movements and behaviors. This is the second salient feature of the autism spectrum disorder. These repetitive movements include there is a body rocking. They repeatedly move to and fro, or they used to clap their hands, or flipping their fingers, or jumping, hopping. They used to jump. They used to spin. They love the vestibular sensation. They are addicted with the vestibular sensation, and they used to spin around, spinning and spinning. They loved it, like that. They also the younger children used to when 1 to 2 years children first started to walk with the toe. Later it may be reduced. Otherwise, toe walking is the first feature of the early diagnostic feature of the ASD. So if you try to control this repetitive feature, they go into break into temper tantrums, and there is a self injurious behavior. That is a dangerous thing. They used to bang the head. They directly bang without having the pain. They bang into the wall. Their head. Until it bleed like that. They have the severe temper tantrums. Even they pull their hand or pinch someone. Even themselves, they pinches or mother like caregivers. They used to pinch or hit like that. That is severe self-injurious behaviors and injurious to others also. They are doing. So we have to learn to control how to control the this repetitive behaviors and uh, aggressive things. So that is another topic. Okay. Next, coming to the eighth slide. Eighth slide. That's the eighth slide. Okay. So this is an interesting feature of the ASD, the eye functioning autism. Usually the all kind of claims are happen on this high functioning autism. This is previously it is labeled as Asperger's syndrome, or it is a savant skill. Otherwise, it's called it as savantist autism, like that. They usually have the higher or above average IQ levels. They have the highest peak of ability in a particular area of interest. They often have a great memory capacity to memorize things. They love to memorize numbers, events, dates like that. They also even they have the picture memory, so they can reproduce. Once it is looked, they used to reproduce it, and even years together they keep it in memory. Some kind of things they as it is they can be able to describe it. They usually most of the non-verbal high functioning they used to draw it very nice. They even normal verbal high functioning also, they have the very good capacity to reproduce as it is. Some of the celebrity kind of people also have them high functioning autism. Um, or Asperger's later. Previously, it is Asperger's. Asperger's label some celebrity people are there. Okay. One of the child, my observation, one of the child around 7 years like that. He reproduced the railway station as it is. Once he traveled to somewhere, and he at the train he draw it. Once the first they waited at the railway station and look at the railway station scene, and he as it is, he drawed it. Even the how much wheels in the train also he clearly represent, and the coach numbers and the Hindi. Even he doesn't know the Hindi. He write the Hindi letters as it is. That is a wonderful thing in the savant autism. They have the usually the autistic children have the numerical ability. They are good in memorizing numbers and formulas, identifying similarities and differences. They used to starting the things like that. So this kind of skills can be in future on their life. These skills used to get the profession for them. So some here in mm, Erode, one masala company is there. They used to keep the disabled children. Shakti Masala company is there. they used to keep the differently abled children to their company to keep the things, everything, primary things they used to. They try to do, and they are good salary, they are settled. So like that, we can use their skills to further occupy in this life. Some of the children good at music, many of them is seen at the TV programs, some children singing. And one of the child I observed, the way he used to sing the old classics only. So he loves that old classic kind of music only, and no, otherwise no this kind of uh, nowadays kind of instrumental music. He only loves the old classic songs. He once heard, just as it is he sings. That is his capacity. But other skills are there is artistic features. He doesn't have other things. There is a difficulty to train everyday activities also, but he sings well. So according to this, they have the artistic difficulty. Even the skills are there. These skills can be used as uh, advantage and make them into uh, an expert in the particular field, and we can make them into empowered. Okay. Usually, this seven skill marks the artistic deficit. That is a problem with the this kind of high functioning autism. Okay, ninth slide, please. Next slide, Rakshana.
Yes, ma'am. It's the next slide.
Okay, differential diagnosis. So coming to the differential diagnosis, we have almost all the neurodevelopmental disorder. We can keep it in the as a differential diagnosis. So these neurodevelopmental disorders include first thing you coming to the differential diagnosis with the ASD is intellectual deficiency, and already said it has it has occurred as a comorbidity, or it is together it is diagnosed as ASD and intellectual difficulty. Here the GH people used to make for here yeah, for government programs and government scholarship programs and other benefits. The at GH they maintain the record for their children. Some monetary benefits are there. So for that, the GH people usually made the ID MR with previously it is called as MR. So they write it as MR with ASD, like that, the diagnosis has been given. So, usually the intellectual disability and ASD can be together diagnosed. Because there is usually most of the ASD children also less in IQ level. So, ID and ASD together usually present. Okay. So global developmental delay, that is less than 5 years children, they used to keep put it as global developmental disorder. Another thing is ADHD. ADHD are often confused with the autism spectrum disorder. Even now, the AUHD, that is the latest term used by many, uh, both autism and ADHD together present. What is the differentiating feature is the ADHD children doesn't have the social communicative difficulties, but the ASD child usually have the social community difficulties. And ADHD child is usually very hyperactive. He is very impulsive he is very inattentive in talks, and they have intrusive behavior. They doesn't know. They usually interrupting things. They doesn't wait for the turn taking in speaking. They used to do what he like to do as it is immediately. So running here and there and everything. ADHD is have much in this. Usually, most of the autistic children remain quiet. Most of the autistic children, but ADHD doesn't be quiet. That is a differentiating feature. Next is a Reed's disease. Reed's syndrome, it is only present in the female children. The autistic feature and majorly have the hand movements. They have the major hand movements and social communicative feature, especially present in the female children. That is the Reed's syndrome. They usually pull the hands and picking lips continuously. So one of the child I observed, she is very good in memorizing things. Whatever they she what are the things in my cabin, they he used to, she used to tell the names without asking her, but she has the behavior of pulling her hers and picking her lips until it she pulling picking the lips and it bleeds. Then she doesn't know, just keep it as wiping on another hand, she doing it same. So that is a danger of the self-injurious behavior. So another thing we can differentiate with the ASD is social communicative disorder. So next slide. Next slide. 10th one. 10th slide. Okay.
Yes, ma'am, it is okay.
Okay. Okay. Yeah. Social communicative disorder. That is the one part of the ASD. Only social communicative difficulties present, that is diagnosis as the social communicative disorder. There is no restrictive repetitive behaviors. So, okay. Another is a stereotypic movement disorder. There is only restrictive repetitive behaviors and there is no social communicative disorder. So, social communicative disorder and stereotypic movement disorder. That is a different half of the ASD. Okay. So, that stereotypic movement disorder have the self-injurious behavior. They usually very injurious. They hit one of the child, keep just hitting her hand with on the chest repeatedly when her mother keep, some favorite thing has bringing from him, so he started hitting himself just on the chest. He that the sound of the hitting here on the whole hall of the that place. Like that, they doesn't know that there is no pain sensitivity. That is another feature I have to say. They doesn't have the pain sensitivity. They remain painless. That is the problem. So he hits himself, pick and pinch himself. They doesn't know the pain of it. That is the problem. Okay. Some also they are very sensitive to the pain. Just small touch of it can be pain. There is a extremes. One is painless, one is painful. One is aversion to smell, one is aversion to desire smells. Like that, the sensory kind of things are in the two extremes present in the ASD. Another coming to the tick disorder. That is, we know often we notice in adults too that the ticks are present. There is a rapid eye blinking, twitching of some single muscle like that. There is some vocalization also, some what is it? Some sounds they produce like mm, burping like that. They repeatedly produce. That is the ticks. So next slide. Next slide, no? Rakshana, that is not displayed. Dr. Rakshana, the slide is not.
Yes, ma'am. This is the
Okay,
next
okay,
slide.
okay. Okay. So then coming to the language disorders. Language disorders are ASD and communicative disorders are the both equal part of the neurodevelopmental disorder. There is a language disorder. There is a clear difficulty is expression. They have doesn't know how to express the language. Also, there is a receptive difficulty. Doesn't understand the spoken or written things. That is a language disorder. They have know how to spoke or doesn't understand what is spoken. So that is a language disorder. And the specific learning disorder, SLD. This is often we know in clinical practice. SLD is the specific difficulty. That is a specific difficulty in a academic skill. There is they doesn't know um, there doesn't there is a difficulty like dyslexia and dyscalculia, like the things that is academic. They doesn't have the written expression. There is difficulty in the writing. They're reversing the letters. They miss the letters. They often make spelling mistakes. Some children have calculation. Other dyscalculia is the Dr. Anjali there is a dyslexia, dyscalculia is the major presentations. Dyslexia is there is a writing difficulty. They mispronouncing things like that. They used to write and vomiting things. They often correcting the things, writing. And often, if you look at the paper of the child, additional corrections are a major part of the writing. There is a dyslexia and dyscalculia. They doesn't understand the mathematical factors. There is a simple calculation that's in do. That is a SLD. And they also have the laterality confusion, unable to decide whether it is right side or left side. That is a this is also present in the SLD children. So another is selective mutism. They usually keep quiet in a particular place, and they usually uh, very talkative at the home, that like familiar thing places, and they are very they doesn't talk in the school like of unfamiliar things. That is a selective mutism. Other conditions may include many of the condition we can include like anxiety disorders, schizophrenia, oppositional defiant disorders, like that. Everything we can include, but these are all the major neurodevelopmental disorder we can differentiate with the autism spectrum disorders. So, other medical condition associated with the ASD is that's a Fragile X syndrome and tuberous sclerosis are the major associated feature of neurological condition with the ASD. And epilepsy also, due to the epilepsy, there is a regression of the developed skill that happened with the epilepsy. Every episode, there is a normal, once skill is developed and it go back with the epileptic attacks. That is a problem. There are many other medical condition also associated. This is the major feature: tuberous sclerosis, Fragile X syndrome, and epilepsy. Okay, next slide, please. Next slide. 12th slide. Twelfth one, Rakshana.
This is the 12th one, ma'am.
Not displayed. Okay, okay, now only. So, coming to the my tool, my diagnostic tool, we have developed the Indian Autism grading tool. We have the project with the Directorate of Science and Technology. Here on Engineering College, Pongu Engineering College. There is a computer science department. Dr. Kanimoli Selvi, professor of the department, proposed the project called the what is AI-based mobile application development for autism. The project name is design and development of tool for childhood autism grading using soft computing techniques. Later, the project's objectives are also changed. So after that, we come end up with the early diagnostic tool. So within the limit of the project, we have done it. The AI-based mobile application developed by Dr. Sorry, he's not going to complete his PhD. JRF Mr. Jay Prakash. He is the prototype developed by the him. And I have done the questionnaires, data collection, testing, everything done by me. There is I have done the extensive literature survey before going to the project. At around 6 months, we go for a literature survey and assess all the available tools. What are all the available on the online or what are all the tools used by the clinicians and therapists. We collected everything and combined into everything. We come to them around 400 features of the diagnostic feature. We come to it and again started it and coming to the 28 questions. Just 28 questions in the parental screening tool and 15 categories in the clinical tool. We have developed into them two mobile application. We have developed just simple. We can use it very simply within 10 minutes, 10 to 15 minutes. We have come to the diagnosis with the mobile application. So the data collection, everything done in the SSA schools, Service Abhayan schools. There is special children have created, no? So there we go and collect. Often we have every weekend we have the visit to the schools and collected data. There is a that large data set used to as a training data to the AI model. We have to give the last training data. So only the AI model come to his its own decision to give the right diagnosis. So we collected large data and given its input and the AI model is developed. So, next slide, please. Next slide. Mode of the tool. Rachna. Okay. So, mode of the project is develop an indigenous Indian tool. So we love to have a indigenous, our own Indian tool for the early diagnostic of autism spectrum disorder. So we know we doesn't have the Indian autism tools in many of the fields. So we come to the idea of developing our own Indian tool because if available other available international tools are culturally not sensitive with our children. They develop on their own cultural setting. Just we cannot use it as it is. So our tool will be even there is a cost effective also. They are very costly, you know. So if we have our own Indian tool, we custom it, you know. And cars is a reliable tool usually used in India. Most of the doctors, you know, cars is used as a standard diagnostic tool. So we plan to develop a cost-based tool and use the cost data also as a training data to develop a model. So we develop a questionnaires and descriptive things based on the cost. But it is not the same as cost. We have developed the AI model as cyclostyle things and which is the major features and it keep it as a first primary thing. So that is totally different from the cost. Next slide. 14th one. The IAGT, the Indian Autism Grading Tool, we named it as a Indian Autism Grading Tool, IAGT. So it has it has developed separate two mobile applications. One is for the primary parental screening purpose. It has the only use. It can be used by the parents, caregivers, and special teachers or a psychotherapist. They decide screening and diagnosis are two different things. Screening is the just we know just for looking at the symptoms and it is seen like autism like that we can say that is a screening and the clinical diagnosis is done by the clinician. So we some experimental things like that they given the toys and how they doing like that observation the doctor can do and doing coming to the diagnosis that is a diagnostic tool. So the screening and the diagnostic tools are different. So first one is the primary parental screening tool. They just parent can use it like MChat, Shreya's child told that last week. MChat, most of the doctors know that is the primary screening tool one, not a diagnostic tool. So like that, first thing you have to primary first who is looking the child, usually parents, special teachers like that they look. So they have to know and diagnose the artistic feature with the screening. So that is given as the primary parental app. And second is the clinical diagnostic tool. It can be used by the clinician. Both the apps can be completed within 10 to 15 minutes. And the parental application with the parental application we can use with the children of 6 months to 11 years old children. And clinical tool we can use up to 14 years. Okay, next slide. 15th one. Yeah. Okay, same. So AGT parental screening tool. So that is it has the 28 primary questions. That is a major diagnostic part. And previous to that, there is one. Am I audible? The mic is not working now. Is it okay?
Yes, ma'am, it's okay.
Okay, okay.
Yeah, okay.
Okay. So coming to the parental screening tool, it has the two parts. At first part, there is a five red flag questions. They have just displaying the five major features of the ASD as a question. Just simple yes or no question. If the among five categories, if two or more get positive, the app automatically guide into the further 28 questions and full assessment. Otherwise, just within a 5% we can skip this, screening. We doesn't need to go to the full screening with the 28 questions. There are the major features. The five questions are major features of the ASD we have given at the specified at the cutoff or exit poll like that thing we have given. So if the two or more questions get positive, it automatically guide into the further 28 questions. These questions are usually, yeah, this question given as a 5 point likeness scale is used to answer the question. According to level of agreement, we can from agree to disagree. There is five things. There mildly agree, so moderate, and sometimes agree. Like that, there is a five answering things are given. So we can select according to the agreement of them. According to the symptoms of the child, we can select the agreement. And after completing the 28 questions, automatically the app displays the result and further guide whether go for a clinical assessment or not. If the ASD feature is less, they doesn't they guide further go for next assessment. Otherwise, we don't go like that. Is given. We have developed it in the 10 Indian languages, including Tamil, Telugu, Malayalam. First, we developed in the our native language Tamil and used it with our native people, and then we translate it into other Indian languages. Usually, global translate is at first, and friends like Dr. Lekha and everyone helped in taking the whether it's questionnaires are right with Kannada, Telugu like things. And we have developed the 10 Indian languages. The app has the 10 Indian language questionnaires is there. Okay. Okay, next coming to the clinical app. Next slide, please. It has the Indian IAGT clinician tool. It has 14 subdomains. Like a cause, if someone knows the cause, it has 14 domains. We know. So like that, we had 14 subdomains. It is also not exactly. It is not exactly as it is. The AI model has changed everything according to the priority of the what are the major features presented, that comes first like that. The AI model cyclostyle and given it as a tool, and it has what, how can we comfortably use with the mobile application. We changed the things. So under 14 categories, each has the 7 descriptive items to choose among the normal to mild to moderate, moderate to severe, and severe. These are the 7 descriptive items. According to with some descriptive everything has a 2 descriptive items. So clinician can choose his choice according to his observation, clinical observation and experiment with the child, and if he can select which category of the symptoms the child has. So once the item has selected, other other 6 items can be hidden. So easily we can skip to the next. We rapidly complete the 14 subdomains within the 10 minutes. After completing, immediately the AI model displays the results and describes what category of the child ASD the child has. Whether if he has a mild autism, moderate or severe autism, it displays the results, and this thing help the clinician to further plan for this treatment or monitor the progress. It is the tool's main purpose is the monitoring the progress of the child. It can be happen easily. Otherwise, the assessment usually all the psychological assessments are very time consuming and laborious process. It is not possible with our regular crowded OPTs. So within 10 to 15 minutes we can make it. That is very helpful for the practitioner. So that is the main purpose we develop as a mobile application. So, okay. Seventh one, I can come to the conclusion. 17th one. Okay. Thank you for your patient listening. I am very, this is few of my public presentation, so doesn't have that much language skill to present with that much audibly and bold in front of every one of you. I myself actually had some SLD feature that is from my childhood. I have some dyscalculic and dyslexic problems I had, and I myself left-handed converted into right. That is forced into right. I am grown in the yeah village, so the people doesn't like to do everything on the left. That is so they forced they cold and was in hit and change like that is everything happened in my life. So with all the difficulties I learned the things. And my quest for the knowledge never end. So I learn and learn, and with my slow learning I come to the everything I'm expecting in this. So thank you. Autism spectrum disorder also is a lifelong condition. So, every autistic child or any developmental disorder child, it need a lot of care and support. So, every one of us being together with them, so we have to support and wait for them to cope up with it, so they can able to live with that problem, but the conditions cannot totally I said as a homeopath, we can able to make the changes with them, but we cannot cure the thing. That is, we have to accept the thing. So we what a little thing we can make, we can do it. So okay, so we have but the early diagnosis have the major role in this. I observe if a child is given within the 3 months to 6 months of child, it have the rapid changes with the homeopathic medicine. Very the difficult factors are very much limited with with our homeopathic medicines. I noted it. So we try it and yearly itself. Don't wait for coming for the diagnosis. Or if some features you noted, just without labeling it, we can treat it. That is a thing. We cannot go for a costly diagnosis or everything. Just we know the we have to know the what are all the clinical feature of the disorder, and if the disorder the features are present, we go with the treatment. Later you can they will the parents will come to the mindset for something wrong with my child. Thereafter we can give the label to them. So they themselves come to the label first. Then after we go for an assessment. If they come, is there something wrong with their doctor like that? They come in. We can yes we can go for assessment, and we go it, and we can treat them also. Okay. Thank you all of you.
Yeah, that's a wonderful presentation, Dr. Poonguzhali. Actually, you covered most of the things that was on my mind, especially regarding early diagnosis and all the features of
Okay.
autism and other things. And that's
Okay.
interesting that you yourself had a left-hander, being left-hander and converted to right hand,
Yes.
because there
Yes.
are very small deviations in regular children, which will have a wrong label as well so many times, or they are
Yes.
having some inadequacies which will lead to little major issues in their like adulthood because of the inconsistencies they have. So they are not
Yes,
complying
ma'am.
with the
Yes.
regular children. So they are
Yes.
suffering because of that. And it's
Yes,
very,
ma'am.
I wanted to talk about that also, especially what you said, left-handers. Left-handers are
Yes,
so
ma'am.
many
I do
common
think
things.
of make it as a topic somewhere
Yes,
like
yes, yes. It's a very
because
common thing that they
how
have
much
all
I
the
suffered at that.
features which we will consider for early uh, autism kids, and also
Yes, ma'am.
summer birth. Summer children who are
Yes,
born in summer have
yes,
some
ma'am.
features which is also can be taken consideration under autism. And you
Yes, ma'am.
mentioned
Yes,
about
ma'am.
the uh, selective mutinism that I also had
Yes, ma'am.
spoken about that, and that's a very
Yes, ma'am.
uh, important thing because we can help them
Yes,
so well in certain areas, especially with homeopathy, and that will if we know the things instead of blanket diagnosis that this is autism spectrum and we are not going to help them much. Most of the doctors,
ma'am.
even homeopaths, even before taking the whole case, they may write off, oh, this is autism spectrum. Homeopathy has very limited scope or whatever, what they had their experience. But if we go into
Okay.
details with unprejudiced mind, like Hahnemann says,
Yes, ma'am.
we
Yes,
can
ma'am.
have wonders. And that's a very quite interesting thing that you did it on ground, like not sitting in your AC room, but you did it on the on ground this thing, checked it and ground reality. That's a wonderful thing, Dr. Smolin. I was very,
Thank
very
you, ma'am.
keen
Thank you.
to have you on the board since long time. Yeah, your English is
Thank
little
you, ma'am.
difficult, yes, I agree, but in front of your knowledge, that does not have much, it does not hold.
Thank you. Thank
Yeah,
you, ma'am. Thank you.
and also
So,
your rural this
that
thing
yes, ma'am.
angle.
That is
That's a
all the features
great thing.
make some
Yes,
pull back in me. That is a
correct,
problem
correct.
in that. Okay,
Because we
thanks, ma'am.
have to be in the ground reality. So it was a wonderful thing. As far as I think, we have covered most of the things about diagnosis. We have very wonderful speakers lined up, like Dr. Swaruparani. She is also here, and other few mm, uh, experts as well. Oh, let's see in the future coming up session. Any questions? I want to know how we can get the apps, whatever you mentioned, IGX.
Yes, ma'am. I can share the questionnaires only now, ma'am. The
Yes,
app is
please,
still
please
in a
do that.
copyright issue. They
Yeah.
apply regularly applying it and rejecting. Some reason they said and rejecting like that. It is going on around 3 to 4
Okay.
years. After completing, we have the idea to put it in the Play Store itself.
Okay.
Here, here the parents, special teachers, everyone very appreciated. Even the
Okay.
pediatricians and the psychiatrists. You have done it very well, ma'am. Like that, they're waiting for your app like that. They have the comments, but the copyright issue is there, so doesn't have
Hmm.
able to share the things. That is a problem.
Okay. You share the
I
questionnaire.
already shared.
We'll do it off the
That is
record. In the sense, most
yes,
of
ma'am.
us we will receive already diagnosed cases, so we can
Yes,
help apply it off the record. That will definitely help our understanding. So
yes, ma'am.
let's say you please share the questionnaire.
Okay, ma'am. Okay. Questionnaire I will
Any
check.
other
Okay.
questions, dear doctors?
Yes, any other questions from the group? I don't see any hands being risen. So I think we'll end the session now. Thank you, Dr. Poonguzhali, for the wonderful information that you have shared with us. Yeah, a diagnostic tool is something that is
Shailaja
very
has
important.
someone has
Yes,
raised
Dr.
it.
Shailaja. Yes,
Shailaja.
Dr. Shailaja, you have a
Yeah,
question? Please speak.
yeah, yeah. It was a very wonderful session.
Thank you,
Thanks to
madam.
the doctor. This one homeopathic part, what all they have gone? Just I wanted to know because one case, because without knowing our that this one autistic child, there are so many people have cured with the homeopathic medicines. So starting initial stage, I feel so. So I
Um,
just wanted to know Is there anything? Is it reversible or irreversible?
Ma'am, if you have the child in the early stage, within the 3 years of age, we can confidently go change the symptoms. Just go with
Okay.
symptomatology. We can do it, ma'am.
Yeah, some we cannot label it as artistic child, but they are
Okay.
little bit towards artistic child because of the that patient we can treat with silica, beratacab, and pulsatile also, and tuberculinum, and so many other
Yes, ma'am.
medicines I have seen wonderful results. But any
Okay.
other remedies, you know?
Ma'am, I have one paper. I also shared it. Share it in the group.
Yeah.
Written it in the also that also I will share. I have the first comes the phosphorus comes first, and the zinc group,
Ah.
tarantula, like that remedies
Yes.
come to the.
Yeah,
I
that
use
is,
the
I think,
synthesis first. For the paper, I use the synthesis app. I take all the artistic features from the app, whatever from mine to generalities, everything. I take the what are all the expressions of artistic child. Everything I take and it make it as a major repetition like that. I put it and come to the major remedy list and so with that I with come with the phosphorus as first like that I share this paper now. Okay.
yeah, ma'am, please. Thank you. Thank you.
Yes. Okay. Thank you. Okay. 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 Let me conclude. Thank you,
Okay, so
Anita.
thank you, Dr. Pomuzali. Your inputs were really great, and we really got to know that the diagnostic tools that are available are really useful for grading autistic kids, and they should be used by homeopaths too, so
Yes,
that
ma'am.
they are able to treat better. So, along with the knowledge of medicine, especially with the treatment of autistic kids, it's important that we even know all these things while treating. So, with this, I think we should end our session. Thank you, audience, for being with us,
Okay.
and we are going to have many more interesting lectures following. So, please be
Thank
there.
you. Thank you.
Thank you so much. Bye bye.
Thank you.
Thank you.
Bye.